Hello friends, today we will discuss about the CT cross-sectional study and using both axial and coronal view. So first of all, let us start with the axial view. So here in this CT scan, you can see this is the soft tissue window, and we have given a contrast uh, just to highlight the vascular structure. So lungs pathology are not much visible over here in this window. This is we also called it as mediastinal window. So first thing, we should learn how to determine site determination. So let me show you a slide. And yes, remember, as you can see, how to determine the site. So just imagine that the patient is a person is lying on the patient couch in a CT scanner, facing his left leg toward your right and his right leg toward your left. So this will become left side and this will become right side. So again back to this, and now how to determine the anterior and the posterior aspect. So here you can see this is the bony part, this is the sternum. So it is always on the anterior side, and this is the vertebral body, which is on the posterior side. Now let us discuss about these structures. These are most important structures. So let me tell you that this is the left brachiocephalic vein and this is the right brachiocephalic vein. And these are the number one. This is number 1, 2, 3 are the branches of the aorta, and respectively these are uh, brachiocephalic trunk, left common carotid artery, and left subclavian. So here you will find difficulty in differentiating this thing. So let us start with the left brachiocephalic vein and the right brachiocephalic vein. So the left brachiocephalic vein, as we move down, will come closer to the right brachiocephalic vein to form superior vena cava. So let me show you with the diagram. Here we go. So So as you can say here, this B, number B is left brachiocephalic vein, and it is merging with the number A, this A structure A, right brachiocephalic vein, to form the superior vena cava. So again, let us go back. So here you can again see left brachiocephalic vein, and this is the right brachiocephalic vein. So let us play the video and look these carefully. Now, as you can see, it is coming closer. Let me mark. So here you can notice that this left brachiocephalic vein will, as we scroll down, it will come closer to the right brachiocephalic vein, and finally they will merge to form a superior vena cava. Similarly, these three branches of the aorta, they will come closer and will finally merge into the arc of the aorta. Okay. So as you can see here, yes. So now you can see here, uh, left brachiocephalic vein finally going to merge into the right brachiocephalic vein to form the superior vena cava. In the next section, we will be so, and these three arteries, these are the branches of aorta. Let me show you one diagram. Here we go. Now look at this diagram. You can see these branches: brachiocephalic artery, left common carotid artery, and the left brachiocephalic artery. Left subclavian artery is are the branches. So here in the axial section, they will spiraling around the trachea. So this is how you can recognize. And as we move scroll down, they will come closer and finally get merged with the arc of aorta. So now let us play this video and check. Now as you can see, so these three branches of aorta finally got merged with the arc of aorta. So this structure is arc of aorta, and now left and the right brachiocephalic vein almost merge to form the superior vena cava. So this structure is superior vena cava. So this is the trachea, and easily appreciate trachea. Okay, and let us go further. Let's play the video. So now you can see as we go, as we move, scroll down further in the lower section, the arc of aorta will not be visible, and we can see here ascending and the descending aorta. This is descending aorta, and this is the descending aorta. And here we can see the new structure is emerging. You can see the new structure. This is the esophagus vein. So it drain into the superior vena cava. So this is superior vena cava, and here you can see trachea is slightly widening. So it is started bifurcating into left and the right bronchus. So let us scroll down. Now you can see here trachea is already bifurcated into its left and the right main bronchus. Okay, and here we can see the old structure, some new structure is appearing. This is the pulmonary trunk. So pulmonary trunk is here giving its branch to the uh, this left branch. So will give its branch left and right common carotid artery. So at this upper section, we can see its left branch because it arcs slightly above. So this is the left pulmonary artery, and as we scroll down, we will see the both branches. Okay, so now, so let us move further. Now this section is very important. Okay, so let me mark the structures. Here you can see the pulmonary tract has already given its left and right branches. This is left pulmonary artery, this is right pulmonary artery, and this is again the ascending aorta, this is descending aorta. So here you can see the trachea is already bifurcated into the left and the right main bronchus. So one important this cross section part is very important, especially in the pathology, diagnosing pathology like pulmonary thromboembolism. So let me give some demo about that. Uh, in pulmonary thromboembolism, we will find a filling defect. As you can see here, gray shadow. So this is a this could be a thrombus, and that is obstructing the flow of the blood. So here you can see this grayish part, left pulmonary artery and the right pulmonary artery, and here this you can see. So we called it as filling defect, and this is the characteristic feature of pulmonary thromboembolism. Now, let us come back to the section. So let me remind you, this is a ascending aorta, descending aorta, this is esophagus, and this part is esophagus vein. And this is the pulmonary trunk, already given its branch to the left and right pulmonary artery. And you can see the trachea divided into right and the left bronchus, and giving its further branches. So let us go down. Now, uh, before proceeding, let me give you significance of some clinical importance of ascending, what pathology can be seen at this level, and regarding this ascending and the descending aorta. So let us understand the various effect of the arc of aorta. Sorry, ascending aorta and descending aorta. So remember here you can see some kind of partition over here. So this is actually case of dissection of aorta. So we can see a true lumen and a false lumen. So a true lumen is looking slightly hyperdense than the false lumen. This is due to the fact that there is a this part is patent and blood is flowing through this, and this is the false lumen. It contains only the thrombus and there is no blood flow. So how this is how we can diagnose the uh, dissection of aorta. Another thing is, let me show you one more slide. So the important thing is that if you see some kind of outpouching like that, this from the arc of aorta, either from the descending aorta or ascending aorta, so there is a significant enlargement of arc of aorta or descending aorta, and this condition is known as aortic aneurysm. So you must keep this thing. Now let us come back to the section, and let us scroll it down to see the other structures. So here you can see, now friends, here you can see some structures are over there. So here uh, superior vena cava already merged into the uh, right atrium. So this is a part of right atrium, and this part, this surrounding this rounded part, let me mark. This is the still ascending aorta is there, and this is the left ventricle. It forms most of the anterior part, and this is esophagus. You can see non-vascular structure containing air inside it, and this is the descending aorta. Now let us move further and check. So let us pause here, give up, and try to understand. So this is ascending aorta, just going to open in the infundibulum of left ventricle. Still left ventricle is not visible here. So here you can see that superior vena cava is almost merged into the right atrium, and this is the left ventricle. It forms most of the anterior part of the heart, and this again ascending aorta. This is descending aorta, and here is esophagus. So now here a new structure is emerging, that is the left atrium, left atrium, and it will be receiving its pulmonary branch from the both of the side. Let us scroll down. Now here you can see left atrium is becoming more prominent and clear, receiving its left pulmonary vein, and here you can see a right atrium. This is again the ascending aorta, just opening into the infundibulum of left ventricle, and this is the right ventricle, and this is again esophagus. This part is esophagus vein here, and this is descending aorta. Now here, look carefully. The structure is all very important. Here you can see this ascending aorta just opening into the infundibulum and inside into the left ventricle. So still left ventricle is not much visible at this level, but we can make just judgment that it is about to opening to the left ventricle. So this is again right ventricle, this is right atrium, this is left atrium, and it's receiving its pulmonary branch from both sides, and this is descending aorta. And this small part over here is zygous vein. So let us scroll down and check. Now, yes. Now look at. Now you can see the left ventricle started appearing. This is the left ventricle. This part of left ventricle, and we can see that left atrium is opening into the left ventricle. And this is the so here you can again see left ventricle receiving its pulmonary branches, left and right pulmonary branches, and this is the right atrium. This is the right ventricle, and this is descending aorta, and here you can see zygous vein. Now at this level, the left and the right chamber are visible. You can see this is the left ventricle and this is the right ventricle. And you can see this grayish or hypotenuse area separating the both chamber is interventricular septum. And this part is esophagus, and this is descending aorta, and this is esophagus vein. Apart from this, you can see multiple hypotenuse structure. These are pulmonary vessels. So let us scroll down. So now you can very well differentiate between the left ventricle and right ventricle, and this is the right atrium. And here superior vena cava will not no more be visible. Rather, the inferior vena cava will start appearing here. So this part you can see is inferior vena cava. So this is again esophagus. This is descending aorta. This is esophagus vein. So let us proceed. So you can see inferior vena cava completely clearly over here, and the structure are same. No, as you can see, new structure is emerging. This is the liver. Okay, so now we have just entered the abdomen cavity, and we can see esophagus over here. You can still see descending aorta. So let us trace further. Now you can see here the esophagus is just going to open into the stomach, and this part is the stomach containing air and fluid, uh, and this is the liver on the right side. And still we can see this descending aorta, and let us trace further. So now, friend, we can see here the new structure is emerging on the left side. That is crescent shape. This is the spleen. This is a new. So now this is the descending aorta. This is the liver, and this is the inferior vena cava, and this is the stomach. And let us proceed down. Scroll down. So now we have just entered inside the abdominal cavity. This is liver, inferior vena cava. These are the bowel loops. And this is descending aorta, spleen, and this is the left dome. This is the right dome. Still, we can see the remnant part of left and the right lung over here. So that was all about the axial cross-section anatomy. Let us proceed further and discuss about the coronal section. So friend, now let us discuss about coronal view, and so you can see this very fastly. So here we are moving from the anterior part of the chest to the posterior. So at the anterior you can see certain this hyperdense structure. These are the rib, and these hypodense structure. These are the costal cartilages. So as we move, you can see certain places part of sternum, manubrium sterni, and xiphisternum. So let us proceed. Now we have entered the chest, and the most anterior part we will see the apex, part of the left ventricle forming the apex. So this is the left ventricle. So let us scroll further. Now here we can see clearly one thing. Let me mark. Here we go. So you can see this is the left ventricle, and you can see this is ascending aorta rising from the left ventricle, and here it form ascending aorta, and here it form the arch of aorta. This is the arch of aorta in coronal section, and just below to this is pulmonary trunk. So always remember, this will always beneath the arc of aorta, pulmonary trunk. Now let us proceed. Now here, let us stop for a while. And here we can see superior vena cava is turning into the right atrium. And here again, we can see the pulmonary trunk, and you can see here the arc of aorta giving its branch. So this one is left common carotid artery. This is the brachiocephalic trunk here. So third branch is not visible in this structure. Other structure you can see, notice here is the liver. You can see this the dome of, this is the right side, the right dome of liver. On the left we can see this is the fundal shadow. Let's scroll further. Now we have reached the posterior part of the heart. So now here the we can see left atrium here, this hyperdense or bright structure. So it is receiving its pulmonary branch from both sides, and this is again the pulmonary trunk, and this is the arc of aorta. Here you can see part of trachea is also visible. So let us scroll. Now you can see this trachea is already bifurcated into its main left and the right bronchus. So still we can see this is the arc of aorta, this is pulmonary trunk, and this is the left ventricle. Now here one important thing you can see as we proceed, this is the arc of aorta, and this is the descending aorta. Here you will notice one important thing, that as we proceed more posteriorly, you will find that this part is get constricted. So sometimes you can confuse it with some pathology, but this is due to the normal course of aorta.